This week on Just Solutions, LGBTQ seniors are facing specific challenges as they age, from healthcare to housing access and much more. According to the AARP, many are concerned about having enough support from family and friends, and also worried about how they'll be treated in long-term care facilities. Dr. Julie Bates with AARP says LGBTQ older adults have also been disproportionately impacted by the coronavirus pandemic. So what can be done to help, and what policies need to be put in place to serve this population? From Free Speech TV, Just Solutions. Dr. Bates, it's great to have you with us. Now, the AARP has been really digging into issues facing LGBTQ seniors, and you conducted a survey that we're going to talk about in just a moment, and the very specific issues that are facing this population. But give us a sense of the numbers. I believe I saw something like a projected population of 3 million LGBTQ seniors over the age of 65 by 2030. But what's your sense of how big this population is that we're talking about?
You know, the question about how many are there is a difficult question to answer. And one of the reasons it's difficult to answer is simply because of, one, a lot of times the question's not asked of who you are in the ways that we capture data. And so, you know, there's this range of how many LGBTQ older adults are there? Will there be 3 million 65 and over LGBTQ identified? Will there be 5 million 65 and over? I think as time goes on, those numbers will become more and more concrete as we become better and better about asking questions. But if you aren't asked your identity in the census, or you're not asked your identity in all of the places where we collect demographic data, it is difficult to know. And then the other caveat to that is our older adults, particularly the 65 plus, came of age during a time when it was detrimental to their financial well-being, their physical well-being, their well-being, period, to identify themselves as being a member of the LGBTQ population. And so sometimes they are reticent to share that part of their identity on any official paperwork. So the long answer to that question is we don't know for sure, but there are more than we know, right, that we have been able to collect data on. You know, one of the things that AARP is really proud of, and we use tools to help us identify even our own membership. You know, we have 1.156 million members who are LGBTQ. Now, of course, our membership starts at 50. You know, and that's the other thing that makes it difficult to truly fully identify who the LGBTQ elder is based in age cohort. It depends on what standard of the age cohort you're going to be asking. Is it 40 to 55, then 56 to 64, then 65 and over? All of those things play a part in helping to determine how many LGBTQ older adults, particularly 65. I think 3 million is a lowball estimate. And by the time we get there, we'll see a bigger number.
I think what underpins so much of what you've just said there is that we are, despite all the advances that we have made in LGBTQ rights and equality, we're still a very heteronormative society. And so all of our institutions and all of our cultural attitudes assume that people are heterosexual. And so for people to not be asked in an appropriate way, so we don't actually gauge this, but particularly for elder adults who, as you said, have come up through the time where for many it was illegal, it was detrimental to their financial health. They could have lost a job, they could have been put into a mental health facility against their will. That if you're not asking in the appropriate ways, you're not going to get the answers and the data, you know. So as we dig into some of the very specific issues, I mean, what are your thoughts on that? That despite all of the advances, we're still very heteronormative. And so our assumption is people that we meet are going to be heterosexual.
Yeah, yes, that is how people walk in the world. We assume that people are, or we look for ways for people to be like us. And when you live in a culture that is a heterosexual culture, there is this term, the heteronormative culture. It is the majority population around the world. And we are conditioned to assume that every person that we meet is straight or they're heterosexual. And it doesn't matter how you present. Even in 2021, you can be any of the stereotypical embodiments of a lesbian, gay man, transgender person, or a bisexual, and the person encountering you is going to assume that you are a straight person because that's their frame of reference, right? And we know we have seen this ebb and flow of how cultural institutions, government institutions, our healthcare systems have gone about either embracing the asking of the question and embracing the welcoming of the LGBTQ person, and depending on where we are in that ebb and flow, depends on how people ask and whether or not it's even top of mind to include on a form at a doctor's office instead of saying, who are you? I'm Dr. Julie Bates. And the next line is, who's your husband? Well, I don't have one, right? And so I could leave that blank or mark it out and say my spouse, or mark it out and say my wife, and put my wife's name down. And there was a whole, pardon me, discourse over the last census about whether or not to include a question about sexual identity and the makeup of the family in the residence. And even though the question was asked, we need to recognize that 10 years before was the first time that question was even asked in a census. So we don't have a long history of governmental collection of data for LGBTQ people. And as one of my colleagues, Dr. Nicorle Corte says, no data, no justice. If we don't collect the data, there is no way for us to be able to strongly stand in assertion of who it is we are trying to serve. And if you don't have the numbers, then you don't get the money, right? You don't get the money for older adult programs through the Area Agency on Aging if we can't say there is this amount of older LGBTQ people living in my community. We don't get the money for healthcare research if we're unable to say these are who the older LGBTQ people are in this state, in this region, in this country, in order to have specific healthcare research done and surveys done and things to that nature. So that's why it's so important for us to begin to change how we ask questions, begin to change, how, people kind of walk in this world. But we do tend to assume people are like us. And so if the majority of the population is straight, which it's going to continue to be, right? That there's not going to suddenly be the gay people are the number one population base, but we need to change the context around how we identify people and make sure that instead of assuming, because we know what assuming does, right? It's never a good thing just to assume, but to ask the right questions. Instead of, gee, I see you wear a wedding ring. What does your husband do? Say, gee, I see you wear a wedding ring. What does your spouse do? And that gives me the opportunity to tell you who my family is.
And it goes far beyond the personal, aspect of this and how we make individuals feel when we don't, recognize them. But there are broad implications for how we're structuring elder care, whether it's retirement homes, nursing care facilities, even our legal system, how we have that set up for people who don't fit into that box, that legal recognition of being married with children, who will be your, say, legal advocate when you can no longer make healthcare decisions. I mean, all of that has broad implications for LGBTQ people who've had to, for many decades, potentially struggle against the system and hide their identity. So in terms of some of those things I've talked about, if we talk about housing, For people who are concerned about going into, say, some type of residential care facility, as many elders do, what are some of the considerations that you're seeing that you saw identified through the AARP survey that LGBTQ elders are facing?
Well, the first thing I'd say about that, of course, we have done significant amount of research into the LGBTQ lived experience. We did a seminal piece of research called Maintaining Dignity that we're about to put out an update. We did a community, the Black LGBT community survey, and others, Vital Voices, that help us to understand the LGBTQ lived experience. And we know that, LGBTQ older adults, particularly of this current generation, are less likely to have family support. They're more likely to have had a disconnect, pardon me, to their family. We know that they are concerned about accessing services. We know that a full, 34% of LGBTQ older adults are concerned that they're going to have to hide their identity in order to have access to suitable housing as they age. We know that they're concerned about the people who provide care for them, and of course they're concerned about outright discrimination. I mean, we know, not every state is a blue state, and even within blue states there's red people, if you want to look at the red and blue analogy. So that's one of the reasons why AARP is in such strong support, pardon me, of the Equality Act. The Equality Act is federal legislation that bars discrimination to LGBTQ people. Because LGBTQ discrimination is an aging issue that endangers health and financial security and personal fulfillment. To many of the 50+ older adults. LGBTQ individuals should be free from discrimination from entities that the 50+ rely on. Senior centers, meal providers, housing, healthcare providers, all of these things are potential areas of discrimination and that they need to be free from. In our 2018 landmark study, Maintaining Dignity, as I mentioned, 34% of LGBTQ older adults were concerned that they will have to hide their identity in order to access suitable housing as they age. Over half fear racial and sexual orientation discrimination should they need to enter a long-term care or assisted living facility. Social isolation is a major issue in this cohort, because they're afraid to share their whole selves with the people that they are around. So too many LGBTQ seniors are isolated because they are less likely to have adult children to look out for them. They are also more likely to have lost a significant part of their social networks during the HIV/AIDS epidemic. And that all changes how one walks through the aging process. In the heteronormative culture or the heterosexual relationship, the overwhelming majority of older adults have one or more children who are going to provide care for them. As they age, they have a strong and deep social support network that is out to support them. And the LGBTQ older adult population, again, tended to have a disconnect from their family, disowned or disenfranchised from their family of origin. They set about the process of building what we call a family of choice. And then AIDS happened, but also aging happens. If your care group or your support group is all the same age you are, when it's time for you to have some of those normal or expected health issues that happen as we age, needing to have a hip replacement, or maybe having a bout of pneumonia, or any of those things that we expect to happen, all of your care providers are the same age as you and are having the same things. So you don't necessarily have access to a diverse range of age groups to help support you during these predictive activities of aging. And then of course you have all of the societal constructs that make aging more difficult for a disenfranchised group.
You mentioned isolation. I know that folks in rural areas are experiencing isolation much more, but also COVID has particularly hit the LGBTQ population and LGBTQ seniors. Talk a little bit about that.
COVID-19 has really brought into focus for all of us, which I think is going to have long-term positive effects on how we deal with things like social isolation. But when you don't have a broad network of social support, you're not participating in some of those governmental structures that help provide community, like the senior center or the congregate meal site, or some of these, or at church. So all of the things that you do in order to engage with community closed because of COVID-19. We weren't going to our restaurants and bars to be, with each other. We weren't going to group activities where we could be with each other. And because of the unique nature of what was our first epidemic in our lived experience, the AIDS crisis, right? If you're an older adult and you lived through the AIDS crisis and you saw how the culture reacted to you, right? This was the gay plague. It's okay. It's only gay people who are dying. We don't need to put any funds or support in regards to that. The government, as the government blamed gay people for HIV. And so you have that in the back of your mind, right? You have, gee, things didn't go so well the last time we had a pandemic or an epidemic, and you're faced now with this new thing, and this new thing that is COVID-19. And so you are less likely to avail yourselves of the expanded services that came into being because of COVID-19, either because you didn't know they existed, because you weren't already in a system that made it possible for you to know that there were new programs of meal delivery, and that there were new ways of connecting, pardon me, by phone with others who were also isolated. COVID-19 caused people who may have had a social network or a social experience to become isolated, like many in the culture. It didn't matter if you were gay or not, to become isolated. And if you were already isolated, you became more isolated because of COVID-19.
You mentioned the Equality Act, and that is, as you said, a big piece of federal legislation. I believe it's facing a vote in the Senate, albeit it does not have a lot of Republican support in the Senate yet. And I know groups like the AARP and many other advocacy groups are really pushing hard to get this passed. Many people might be surprised to hear that we don't have that legislation already in place, because we do have certain pieces of legislation, certain provisions, but nothing as expansive as the Equality Act. What impact would that have on LGBTQ seniors?
It'd be huge. It would be huge. It would be huge. I mean, because the thing you have to remember, right now we have a patchwork of rights, depending on what state you live in, and sometimes what county you live in within a state, or the patchwork of federal protections that protect LGBTQ people. So by having the Equality Act, and of course AARP is in support of the Equality Act. We supported it the last time it was introduced, and we're cautiously optimistic that there will be broad bipartisan support and passage of the Equality Act. By having this kind of legislation that truly is expansive and covers all of the different things, it wraps up the LGBTQ community and all of the various civil rights legislations, right? So you can't, you aren't faced with, we all have now marriage rights in all of the states. I get married on Saturday, I go to work on my day, and I get fired. Or I get married and I go to look for housing, and they deny me housing legally because I'm gay, because I'm married. That's a legal public document, and they know that I'm married. And so they're able to keep me or bar me from housing. This would be a significant bit of civil rights legislation for LGBTQ people of all ages. And of course, it also would have unique impact for our older adults, particularly around that housing issue. Because when you find yourself moving from long-term housing, right? Like if the time came that I needed to move from our home, my wife and I bought this house 26 years ago. I expect to live in this house well into my 80s. But if we need to move to long-term care and we live in a place that doesn't have protections, and you're filling out your paperwork. I mean, it's obvious that we go together. Our bank accounts are the same bank account. Our address has been the same all this time. Obviously, we belong together. To have to worry about the place that we want, that we know has an opening, saying, no, we're not going to take you because you're gay, and having that be okay, right? That's a scary, scary thing when you're already in a scary situation. So this type of legislation takes that worry away. It's one less thing you have to worry about. And when you're in the situation of needing to make a change, or needing to access healthcare, or needing to have a job, all of these things, not having to worry about that makes it easier. And that's the point of these kinds of legislations.
Now, the AARP, by its very nature, deals with older adults, but the LGBTQ advocacy groups, do you see enough consideration of what's happening with elders there? And I guess I'm trying to get to the intergenerational attitudes, because you have young people now who have been born into a society where there's a lot more acceptance than there was decades ago. It is not perfect at all. And of course, we understand that, but it's quite a different reality. So do you think there's a real understanding of what people have gone through, what people have fought for to even get us to this point? I mean, what we need to do to even move the LGBTQ community to a place of real acknowledgement of what seniors are going through?
Well, that's a challenge no matter, right? The stereotypically, the young don't think of the old, and the old think that the young are careless and don't work hard, and aren't going to, do anything worthwhile, right? Both stereotypes are wrong. There are many, many wonderful organizations, whose sole focus is the LGBTQ community, and they are doing great work in ensuring the legacy of our elders is maintained, and that our young people benefit from the pioneering ways of these pioneers. I think what's important is to recognize is today's youth have no context. They have no context of what was before. And just like every other generation, I mean, if you look at, the baby boomers and the hippies, right? And you look at, Gen X and the slackers, right? We were slackers first before we became Gen X. Every generation sets their own identity. They come up, they figure out what language applies to them, what labels apply to them, what things that they want to help them be separate or different from those that came before. And there's nothing wrong with that. There's nothing wrong with that. But we also need to help them understand and set context for them. I did a lecture for a group of university students, and I showed a documentary from the Clowder group called Reels in the Closet, which was a home movies of LGBTQ people in the 40s, 50s, 60s, in even earlier. And they showed happy, engaged gay people. And the students had no idea why that was a big deal. They did not understand that there was a time when just making these movies endangered the livelihood of the people who produced them, and went completely contrary to the context of the social structure at the time. So we do have to continue to do well to educate, and we're seeing more of that. We're seeing the LGBTQ history provided in history books, just like we're finally seeing the African American experience in history books, positive roles and actions, and all those things are finally getting put into our history books. We're seeing documentaries that help us all understand, that all ages can participate in, to understand what was, why we have to continue to fight. The reason we have Pride Month isn't because we just want to have a party, right? Yes, it's commemorating a riot, the Stonewall Uprising. But it's also because we are still in the minority. We are still in a position where we can be taken advantage of, disenfranchised, our rights, are assailed, in multiple arenas at any given time. And so we have Pride Month as a way to help the greater culture understand that, yes, we're still, gays are still here. We've come a long way, but there's still a long way to go. And it gives our youth the opportunity to come together with multiple generations. When we come together in multiple generations, we have conversations. And when we have conversations, we can build relationships. And when we build relationships, we build friendships and we build understanding. And having the opportunity to do that, whether it's at a pride parade or an LGBTQ center or in a classroom or somewhere like AARP or the Human Rights Campaign or any other wonderful organization that's doing the work, we build understanding and we grow.
We just have a couple of minutes left, Dr. Bates, but what's the biggest takeaway that you got from the survey done by the AARP, the report that came out in 2018 that's being updated now? If there's a big takeaway from that, of what we need to do, what is it?
I think the biggest takeaway is that old adage, we've come a long way, but we still have a long way to go. And that our LGBTQ older adults are still in a position of disenfranchisement, and that we have an opportunity to make things easier. We have an opportunity as a culture. We have an opportunity, of course, as AARP, to advocate even more strongly for the LGBTQ older adult and all things from Social Security, making sure they get survivor benefits and all of that. But what Maintaining Dignity does is open that research, opens the conversation for people who had no understanding, who had no context, to have aha moments and to recognize that their neighbor, the LGBTQ person is our neighbor, needs help and support and services, and to be able to advocate in their behalf.
Well, organizations like the AARP have a lot of very specific resources and supports for LGBTQ seniors, and all very accessible on the website. But in the meantime, Dr. Julie Bates, thank you so much for being with us. We appreciate you joining us today on Just Solutions.
It was my pleasure. Thank you so much for having me.
And on next week's show, rather different topic, we're going to be taking a look at an issue that's plaguing many parts of rural America, the growth of industrial feedlots and what that's doing to the environment, but what it's doing to communities who are living beside them. We're going to hear about an investigation into such feedlots that's happening in Wisconsin. That's next week, same time, same place, from Free Speech TV, Just Solutions.